Hi, my name is Kaylee Carter. I am a registered nurse on a coronary care progressive care unit. At my place of employment, I often take care of heart failure patients. In my practice as an RN, I've noticed not only patients and family members, but fellow RNs and healthcare providers have a lack of understanding of what palliative care is and how it could benefit heart failure patients. With a lack of understanding of what palliative care is, there could be a delay in providing this resource to this patient population. My Change project intends to increase awareness of palliative care and thus increase consults of palliative care, as well as increasing staff satisfaction on care provided and patient satisfaction of their goals of care being met. Heart failure is a progressive and ultimately lethal disease. There are two types of heart failure, systolic and diastolic. In diastolic heart failure, there is a problem with how the heart fills blood due to stiff or thickened heart muscle. In systolic heart failure, there is a problem with how the heart pumps blood to the rest of the body. In biventricular heart failure, both sides of the heart are affected. Either way, the heart is unable to adequately supply blood to the body. When the heart is not pumping effectively, you can develop distressing symptoms. These include swelling, dyspnea or trouble breathing, weakness, and fatigue. Treatment often involves aggressive diuresis. Thirst and dry mouth is an uncomfortable symptom of diuretic therapy. The symptoms that come with heart failure are very distressing and they would affect anyone's quality of life. This is where palliative care can help. Palliative care is a resource for anyone living with a serious illness, in this case heart failure. Palliative care can help patients and family members make treatment goals and stay informed of their treatment plan. If you think about it, nurses already perform palliative care measures for this patient population. We assess and treat pain and anxiety, position and use cool fans for dyspnea, and mouth swabs for dry mouth and thirst. Although this resource could be beneficial for heart failure patients, there is not a consensus of when to consult palliative or a standard care model for referral times. This ultimately leads to delaying palliative care until a patient is opting to receive hospice care or full comfort measures. According to the optimal model of palliative care for patients with advanced heart failure, timing of referral should be when patient develops New York Heart Association, NYHA, class 3 or 4 symptoms, or American College of Cardiology, American Heart Association, ACC/AHA stage D disease. The NYHA classifies the extent of heart failure. Class 3 is marked limitation in activity due to symptoms and only being comfortable at rest. Class 4 is severe limitations with symptoms even at rest. In comparison to the NYHA functional classification, the ACC/AHA heart failure stages include additional information on the severity of heart failure and relies on risk factors and structural abnormalities in the development and progression of heart failure. Stage C is patients who have developed clinical heart failure. Stage D are patients with refractory heart failure requiring advanced interventions. Although this is a chronic disease, it is marked by exacerbations and remissions, so prognosis can vary. Sometimes this makes it hard for a provider or nurse to talk about palliative care with the patient or family. Some sources recommend the optimal time for a palliative consult is at diagnosis. According to the National Institute on Aging, palliative care is a resource for anyone living with a serious illness such as heart failure. Palliative care can be helpful and provided at any time during a patient's illness, the optimal time being upon diagnosis. Palliative care can be provided along with curative treatment and does not depend on the prognosis. A hospital in Canada, North York General, has actually formed an initiative for early palliative care in advanced heart failure known as a new model of care and integrated approach to palliative care for patients with advanced heart failure. This hospital created a supportive cardiology team with program goals to increase advanced care planning, decrease emergency department visits, reduce recurrent hospitalizations, and increase staff, patient, and family satisfaction. With this management, they have found an increased number of goals of care and advanced care planning discussions and positive feedback from patients and their families, as well as the cardiology team. The first step to implementing a change is to identify barriers. In this case, the barrier to lack of providing this resource to this patient population is the need for more education on what palliative care is and how it could benefit this group of patients. One misconception I see a lot are palliative and hospice care are the same. There are differences between the two. Hospice is a type of palliative care for patients with a limited lifespan. Although both services are aimed at providing comfort and relief of symptoms, palliative care is for people at any stage of an illness, and the condition does not have to be uncurable. In order for this service to be more utilized for the heart failure patient population, the patient's family members and staff members should be educated on the mentioned information. A lot of patients don't realize the severity of what a heart failure diagnosis means. 50% of heart failure patients will die within 5 years of their diagnosis. With an awareness of the severity of this disease, they should be allotted resources to cope with the symptoms and treatments that will come along with this diagnosis for the remainder of their lives. I and other healthcare providers can make a difference by educating on the severity of this disease and also educating on what resources they have available to them to make the most informed choices and improve their quality of life. I will provide education on palliative care through utilization of a pamphlet or flyers and also word of mouth. Spreading awareness can make a huge difference in promoting this resource, doing what is right for our patients, and providing the best possible care for this patient population. Assessing a patient's goal of care is a focus of palliative care and can be measurable by interviewing the patient and seeing if their expectations of care are met. Living up to the patient's goals of care can also improve the healthcare provider's satisfaction of care provided, as they are making a difference to the patient's quality of life. Certain outcomes, such as palliative consults ordered, staff satisfaction, and patient satisfaction with their goals of care, can be assessed and measured to evaluate the efficiency of providing education on palliative care for heart failure patients. I think a reasonable time frame for this project would be measuring and implementing the above for 3 months, and then implementing the said measures, and then measuring the outcomes after this implementation. Key outcomes to assess would include patient satisfaction of care provided, patient satisfaction in their goals of care being met, and measuring the amount of palliative care consults ordered. With an increased awareness, hopefully this resource could be more utilized for this patient population.